Hemorrhoids are one of those things that are incredibly common, affecting millions of people, but we just don't really talk about them. Well, in this explainer, we're going to do just that. We're going to give you the clear, straightforward info you need to understand what's going on, and most importantly, how to find relief. And look, it can feel a little awkward to talk about, right? That's probably why it's one of the top health conditions people search for online. So if you're here, you're probably looking for some real, trustworthy answers, and that is exactly what we're going to provide. First off, you are definitely not alone. So here's what we're going to do. We'll start with the absolute basics, what hemorrhoids actually are. Then we'll dive into the simple things you can do at home to manage them. And finally, we'll take a look at the medical treatments out there that can bring more lasting relief. All right, so let's start at the very beginning. What are hemorrhoids anyway? To really get why they become a problem, we first have to understand that they're actually a normal part of your body. Okay, so here's probably the most surprising thing you'll hear today. Everyone has hemorrhoids. Yep, they're not some kind of disease, they are a completely normal part of our anatomy. Just think of them as these little cushions made of tissue and blood vessels located inside the anal canal. And get this, they're not just hanging out, they actually have a really important job. These little cushions act like a natural barrier, helping us with continence and preventing minor leakage. So when they're behaving, they're actually really helpful. Okay, so if they're normal and they're helpful, why in the world do they become such a problem? Let's get into the symptoms and the different types of hemorrhoids. Right? If we've all got them, what's the trigger? What's the thing that turns them from this normal body part into something that's, well, a real pain? Well, it really boils down to one word: pressure. Anything that increases pressure down there, we're talking straining on the toilet, dealing with chronic constipation, or even the changes that happen during pregnancy, can cause these tissue cushions to swell up, stretch out, and start causing symptoms. Now, your doctor will talk about two main types, and it's all about location, location, location. You've got internal hemorrhoids, which are higher up inside the anal canal, and then you have external hemorrhoids, which are on the outside. And this difference is super important because the symptoms and the treatments can be totally different for each one. And for those internal ones, doctors have this pretty straightforward grading system to figure out how severe they are. It really just comes down to whether they stick out, or prolapse, and how much. Now, don't worry about memorizing this. It's just a tool your doctor uses to figure out the absolute best plan for you. Okay, let's talk about what is, for real, the most important part of all this. For most people, the journey to feeling better starts right here, with simple things you can do yourself. This is your first and honestly, your most powerful line of defense. It's so important to get this. For most folks, jumping to a medical procedure is not the first step. Unless things are really severe, the foundation of treatment is almost always what doctors call conservative care, which is just a fancy way of saying at-home management. And the number one goal is to reduce that straining, right? We do that by making your stool softer and easier to pass. And the key to that is fiber. The goal you're shooting for is somewhere between 25 and 50 grams a day. And since that can be kind of tough to get just from food, a lot of people find that a fiber supplement is a huge help. So why fiber? Well, I love this analogy. Think of it like a sponge. Moving through your system, it soaks up water, which adds some bulk and softness to your stool. This keeps it from getting too hard, which causes straining, or too loose, which can also be irritating. It's kind of perfect. All right, besides what you eat, a few simple tweaks to your toilet habits can be a total game changer. Try to avoid sitting on the toilet for a long time. And yes, that means no more scrolling on your phone, because that just puts a lot of pressure on the area. If you find yourself straining, it's actually better to just get up and try again later. Oh, and using a little footstool can be amazing. It puts your body in a more natural position that reduces strain. And for some quick, soothing relief, a warm water soak or a sitz bath can feel incredible. Now, all this at-home care is fantastic, but it's also super important to know when it's time to call in a professional and get a medical opinion. And this is a big one. Please don't try to self-diagnose from the internet. While hemorrhoids are really common, other things can cause similar symptoms, especially any kind of bleeding. A quick exam from a doctor is the only way to be 100% sure. It confirms what's going on, rules out anything more serious, and gives you peace of mind, plus the right treatment plan. So, what happens if you've done all the right things at home, you've upped your fiber, you've changed your habits, but you're still not getting the relief you need? Let's check out the medical treatments that can offer that next level of help. Generally, your doctor's going to talk about two main paths forward. First, you've got your office-based procedures. These are usually for less severe internal hemorrhoids. They're quick, low-risk things like rubber band ligation, and the goal is basically to shrink the tissue down. Then, for more severe or stubborn cases, surgery might be on the table. And here, the goal is simpler, to physically remove the tissue that's causing the problem. And hey, if surgery does end up being the best option for you, you can feel really confident about it. This quote says it all. This standard procedure is considered the gold standard. That means it has great results, people don't often have problems again, and it's proven to be the most effective surgical fix out there. Whew! Okay, we have covered a ton of ground, from the very basics all the way to advanced treatments. So let's just pull it all together now and map out your path to feeling better. If you remember nothing else from our chat today, remember these 4 things. Number 1, hemorrhoids are normal. Everyone has them. 2, the trouble usually starts because of too much pressure. 3, your most powerful tools are often simple lifestyle changes. And 4, if that's not enough, a doctor has a whole toolbox of safe and really effective treatments. But here's the real bottom line. You absolutely do not have to just live with the discomfort. Now that you have this knowledge, you can make some smart changes at home and have a much better conversation with your doctor to find the solution that is just right for you. Thanks so much for joining us for this explainer.